नमस्ते।
विस्तारित परिषद की ओर से आयोजित इस अनवरत व्याख्यानमाला में हम प्रत्यक्ष की तरह आज भी आपके सामने नए उत्साह, उमंग, आयुर्वेद को एक अच्छे मुकाम तक पहुंचाने के लिए अनेक श्रेष्ठ वैद्यों की श्रृंखला तैयार करने के लिए आज फिर से हम उपस्थित हैं। और आज का व्याख्यान आपको अभी दूसरे मैसेज से समझ में आ ही गया होगा। जो हमारे पूर्व में डिसाइडेड स्पीकर थे उनको कुछ विशेष काम में वो व्यस्त थे आज, तो वो आज के व्याख्यान के लिए यहाँ नहीं आ पाए। और मैडम के ही सहयोग से आज हमें डॉक्टर नंदा जी से होने का मौका मिल रहा है। और डॉक्टर नंदा, आपका अग्रिम धन्यवाद कि इमरजेंसी स्पीकर के रूप में आपने कल ही बात हुई, क्योंकि मैडम को भी लग रहा था कि वो कर ही देंगे, मगर फिर अचानक थोड़ी व्यस्तता ज़्यादा हो गई तो वो आ नहीं पाए। तो मैडम का भी विशेष धन्यवाद और आपका विशेष धन्यवाद कि ऐसी इमरजेंसी के लिए आपने तुरंत ही अपनी सहमति दे दी। तो आपका धन्यवाद करते हुए मैं आज के सभी पार्टिसिपेंट के सामने आज के स्पीकर का परिचय रखना चाहूंगी। आज के स्पीकर का नाम है डॉक्टर नंदा के ओ, यूजी फ्रॉम JSS आयुर्वेदा मेडिकल कॉलेज एंड हॉस्पिटल मैसूर। 2007 टू 2013 में आपने अपना पूरा किया अंडर ग्रेजुएशन की पढ़ाई। पोस्ट ग्रेजुएशन फ्रॉम STM कॉलेज ऑफ आयुर्वेदा एंड हॉस्पिटल हसन। 2013 से 2016 में आपने ये प्रसूति तंत्र एवं स्त्रीरोग विभाग में कंप्लीट किया है। बेस्ट यूजी एंड पीजी आउटगोइंग स्टूडेंट आपको अग्निवेश अवॉर्डी है आप STM CAH हसन से। ये बहुत प्राउड की बात है और मैं सभी पार्टिसिपेंट को भी कहना चाहूंगी कि ऐसी चीज में आप भी अपना अच्छा पढ़ाई से कर्तृत्व नेतृत्व करते हैं तो ये कहीं ना कहीं हमारे पूरे जीवन की एक झलक भी हो जाती है। एट प्रेजेंटली असिस्टेंट प्रोफेसर एट JSS AMCH मैसूर में अभी वर्तमान समय में आप काम कर रहे हैं और आप पीजी गाइड के रूप में भी प्रतिष्ठित है। और थोड़ी सी और बातें भी जो आपने अपना CV भेजा है उसमें से मैं सभी के सामने रखना चाहूंगी। बहुत सारे पीयर रिव्यूड आर्टिकल्स एज अ चेयरपर्सन, एज अ को चेयरपर्सन, बहुत सारे सेमिनार्स में आपकी सहभागिता रही है। बेस्ट पेपर, ओरल पेपर सभी में भी आपने अपना जीता हुआ है, अपना प्रथम स्थान प्राप्त किया हुआ है। और विभिन्न कैंप्स ड्यूटी और जो हॉस्पिटल ड्यूटीज है उसमें भी आपका बहुत अच्छा कंट्रीब्यूशन रहता है। इसके सिवाय जो मेंबर ऑफ डिफरेंट कमिटीज में NABH, QCI, UI इंचार्ज, वो भी आपके पास काफी अच्छी जिम्मेदारियां हैं जिसको आप निभाते हैं। और जो एक विशेष जो CCRS आयुर्ज्ञान स्कीम जो है EMR प्रोजेक्ट प्रपोजल में 2024 में एज अ PI प्रिंसिपल इन्वेस्टिगेटर आप अभी उसमें आपने अप्रूव्ड करने के लिए वो भेजा हुआ है। बहुत अच्छा है उसका टॉपिक। मैं सभी पार्टिसिपेंट से बताना चाहूंगी कि कंपैरेटिव क्लिनिकल स्टडी ऑन द एफिकेसी ऑफ एरंडमुलादी नीरू एंड महानारायण तेल अनुवासन बस्ती विद मुस्तादी यापना बस्ती नीरू एंड महानारायण तेल अनुवासन बस्ती इन उदावर्तिनी योनि व्यापद प्राइमरी डिस्मेनोरिया में आपने उसको किया है। तो ये बहुत ही अच्छा टॉपिक है और वर्तमान समय में मैं देख रही थी इसके इंसिडेंस 15-16% से लेके 90% तक मिलता है। यानी पेनलेस ऑर्थोप्रोविजन कहीं ना कहीं गुम होती जा रही है। इसके सिवाय आपने CCRS में एक और भी प्रोजेक्ट में एज अ को-PI काम कर रहे हैं, इफेक्टिवनेस एंड सेफ्टी ऑफ आयुष SS ग्रेन्यूल्स इन द मैनेजमेंट ऑफ द लैक्टेशन इंसफिशिएंसी कोलैबोरेटिव प्रोजेक्ट इन 2024। एंड दूसरे भी बहुत सारे उसमें अंडर ग्रेजुएशन पोस्ट ग्रेजुएशन के डिफरेंट में देख रही थी। अब अमा क्षार के ऊपर है और दूसरा साइंटिस्ट स्पॉन्सर्ड अवार्ड। यानी कुल मिला के बड़ा व्यस्ततम आपका जीवन है और आपने बहुत सारी उसमें अचीवमेंट्स, पीयर रिव्यूड आर्टिकल्स, प्रेजेंटेशन सभी से लेके हैं। और आज हमें भी हाँ बोले, ये बहुत बहुत अच्छा विषय है कि अच्छे कामों में तुरंत तुरंत आपकी सहभागिता है। और जो आज का जो ये लेक्चर है, जो मैं सभी पार्टिसिपेंट से कहना चाहूँगी कि ये 10 वर्ष से निःशुल्क रूप में चल रहा है। और मैडम जैसे लोग पता चलते ही है ना, क्योंकि कल ही तो इंट्रोडक्शन हुआ, पता चलते ही आपने अपनी सहमति दी, तो बहुत बहुत हार्दिक स्वागत है, तहे दिल से स्वागत है। और आज के लेक्चर के लिए मैं आपको आमंत्रित करती हूँ। ओवर टू यू डॉक्टर नंदा जी।
Thank you, ma'am. Thank you. Home Gurubhyo Namaha. Respected Hetal Dave madam, for giving me an opportunity, I will be so much grateful to you. And along with that, I am grateful to Dr. Gayatri Bhatt ma'am. She is my guide in my postgraduate. Because of her, today I am here. With this regard, my pranamas to His Holiness, all the Dhanvantri over there. And going with the topic presentation as such.
अभी पीपीटी वो दिख नहीं,
slide share करूंगी मैम। Yeah.
जी 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 हो गई।
Yes ma'am।
ओके
Yes, today I'm here for a strong woman. We may know them, we may be them, and we may raise them, right? As a role as the mother, or maybe one of a woman, where a sister, or maybe a wife, whatever it is, our role is there in each and every corner of a life. In this regard, Stri Moolam Apathyanam, Stri Rakshati Rakshitaha. In this note, I want to say that if you protect Stri, indeed she protect her progeny and followed by the society, and she stands for her family. In this regard, we have every corner, we need to have a highlight the health of a woman's health need of the hour, because if she is healthy, the whole family will be healthy. Keeping in that note, yes, Ayurveda. Today I'm here in the fraternity of Ayurvedic management of common gynaecological complaints, what and all the lady will be encountered throughout her lifespan, that I'll be giving a hint in all the corners, and I'll be giving an insight into it. Going further on, yes, Stri, as I already said, Stri is the one who is responsible for all the thing in the family. And we even correlate that Stri Prativrisheshena Stri Shvapatyam Pratishtitam Dharmartho Strishu Lakshmisha Shidru Loka Pratishtitaha. Means the whole universe is stand only because of women, maybe in whichever the field or whatever it is, and she is referring for Lakshmi, where dharma and artha, everything is relying upon the Stri. And keeping that note, the woman is the root of creation, where she is handling the major responsibility of continuation of her life race or generations, and she is a harmonious of the society, where a nucleus of it, and a healthy, to achieve all those things, where a healthy progeny is the one. In this regard, Ayurveda has given importance in all the life important stages, where starting even from the Rutumati, and even at the stage of Garbhini, and even at Prasava, and followed by Sutika, that is labor events, and even at the Rajo Nivritti, each and every stage, whatever I am mentioning, from the Rutumati, Garbhini, Prasava, Sutika, and Rajo Nivritti, each and everyone has its own crucial point at the point of anatomical as well as physiological changes, where we need to give utmost care and concern so her healthiness will be maintained. Because we have a theme, like we have a reference saying that Shreyasi Praja is the need of the hour. Keeping that note, if we give a healthy marital life, healthy progeny, and a healthy, thereby a healthy social life, all depends on women's health. In this regard, we need to have a consideration of what and all the things in Ayurveda we can think on. See, a simple Abhyanga or whatever the science you speak of, starting from all those things, because our Acharya says Ayurveda is a base science of all the things. Keeping in that note, we need to know in each and every corner of our science, and all the science including Ayurveda stands first. Keeping that note, going especially what exactly the health, because common complaints, prior understanding, as we all know, health is a state of complete physical, mental, and social well, even along with spiritual well-being, but without having any disease or infirmity. But achieving that, yes, it's a note need to be taken care of. Whether I am a healthy person, yes, I can't exactly say all the parameters is fine with me, but still, some extent, the well-being of a woman can be achieved because a sound mind and a sound body, where our sharira is protected, showing so indeed she can achieve all those things because sharira is the one root cause responsible for all the achievements. Keeping in this note, let me go what are the healthy features prior to that. In general, we say a clear skin or a bright clear eyes, neither too fat or not thin, fresh breath, good appetite, sound sleep, regular activity of a bladder and the bowel, and coordinated body movements. Means all in all, it's a generalized thing what we say for a good health. Why I'm saying is, if this is achieved, because whatever now we are looking into the gynecological complaints is totally based on the lifestyle disorders. Keeping that in a note, these are all there. Maintaining a healthy features is in our control, but how we cope up with it, that is the task. Going further with, yes, as you already know, the adolescence period starting with the 10 to 19 years, where the lady will be entering from the childhood to the adolescence period. That is what the thing we need to be have a utmost care and concern. Going with that, adolescence and the progression from the appearance of a secondary sexual characteristic to sexual and the reproductive maturity and the development of adult mental process. And here comes the puberty, where in that too, like development of secondary sexual characteristic, where growth spurts are starting up, and especially here we need to think of Rajaswala Paricharya. Even it looks so simple. What is there to learn when it, nutritious diet and the following rituals and the isolating a lady? It is not so. What are all the care and concern you give it at Rajaswala Paricharya, that is during her attainment of puberty or menarche, what are all the healthy and nutritious food you will be giving? That is a basement. That is a basement for her reproductive health and throughout her lifespan. Keeping that note, what are all the Rajaswala Paricharya we can follow it to maintain her good health and hygiene? Because here comes, once the menstruation begins, then comes the personal hygiene, and especially in sync with her menstrual hygiene. Because even we know that March 28th, usually we celebrate nowadays, it's recently in the past 5 years, we celebrating that as a menstrual hygiene day. Why that is very significant? Because there is some rules and regulations are there to practice during Rajaswala Paricharya. If at all that is practiced, the lady will be with devoid of any infections. Keeping that note, let me give an insight what is an hygiene. As we all know, like public hygiene in relation to the maintenance of like public like sewages and other thing, that is the other end. But when you go with the personal hygiene, that all those things like a nail and the all others in bodily hygiene and other thing, that is also a part of it. But going into the menstrual hygiene is nowadays very need of the hour, and where the students or whoever in that adolescence period, they need to have an importance of hygiene practices, especially main like the menstrual like blood, whatever it is there, like how to overcome with that usage of maybe a simple sanitary cloth or maybe a menstrual cloth or a disposable pad or maybe menstrual cup or a tampon. Because nowadays even that sanitary pad is outdating and is coming the menstrual cup and the tampon. The usage of those things need to be understood well, so that the girl child won't be entering into reproductive life with any genital infections or any other thing. So maybe like pitta javani mapat or whatever we say in further slides, I'll be discussing on that. So here comes the baseline where we need to have a concern of to taken care her menstrual hygiene. This is very much important, even though it looks so simple, because prior I start off with the diseases, these are the basic insights we need to know. And as I am talking to the same fraternity of Ayurveda, as we all know, like regular rhythmic cyclic event that's happening, that is what we call it as physiologically, like whatever the uterine bleeding is, the endometrial shedding is happening, we referring that as a menstruation. This under the control of HPO axis, and we all know that is like it's a preparation of the pregnancy or means preparation of the uterus for future pregnancy and other thing. Keeping that note, nowadays we encounter early what do you call attainment of menarche, that is early puberty, because of the lifestyle changes, maybe the food habits what we eat, maybe the junk or whatever, or the chemical usage, maybe in the like what do you think of like the usage of chemical based products as a cosmetics and other thing, that also have an impact. Or maybe the coloring food habits whatever we use, and the lifestyle disorders, like especially with overeating or obese. Okay, these are all the things, consequences disturbing the HPO axis and leading to the difficulties in what is getting her regularity in cycles. Maybe end up with anartava, or maybe kashtartava, or maybe there is aniyamitartava, where complete disturbance in her cycles leading to the intermenstrual bleeding, or many things that we'll be discussing further slide. And going further with the thing, after knowing the menstrual hygiene, like how to deal with a menstrual flow, as we all know, like menstrual cloth and the reusable pad or the disposable pad and the menstrual cup and the tampon, preferably disposable pads will be the option. Yes, and even then now, like menstrual cups are coming to the picture, because we are still a developing countries where we are into the disposable pad and the menstrual cup. And somewhere in the urban areas even the tampons are in use, but how extent and how legibly the girl child will use, that is having a major impact on her. And how we discard all those things are the basic things, but those personal hygienes are need of the hour. And going furthermore, yes, definitely the painful menstruation, or when you think of Udhavartini Yoni Vapat, as you all know that, what exactly the Udhavartini? Vego Udavartane Yonim Udavartete Anilaha Sa Rugartha Rajaha Krichrain Udavritate. That means the lady will be having the Vega Panavata, which need to be moved in the downward movement. It will be deranged, where Viloma Gati of it will leading to the condition, and the menstrual blood will go with difficult, or it will pass through pain. That is sa rugatraha rajaha kruchena vimunchati. With painful, there will be expulsion of the menstrual blood. Atave sa vimuktaitu tatkshanam labate sukam. Following cessation of menstruation, the lady feels comfortable. Rajasod gamanadurdvam, as Rajas is moving upward, means Vata, Apana Vata, his function is always going in downward direction, where it will be moving upward. So we call that condition as Udhavartini Yonivapat. Okay, that is what Ayurvedic parlance says. But definitely we know the physiological and the pathophysiology of a dysmenorrhea. Yes, definitely the hyperstimulation of the nerve endings, or maybe that cytokines and the vasoconstrictor like things, where estrogen, withdrawal of estrogen and progesterone, definitely there will be derangement. Slight hypoxic condition at the level of endometrium definitely leads to a slight discomfort. These are all acceptable. Slight pain or a moderate pain, which not deteriorating her daily routine, can be considered as normal. Okay, and these are the common symptoms which the lady may encounter during her periods. Maybe a slight variation in her mood swings. Yes, definitely the estrogen and progesterone levels are fluctuating and withdrawing. So definitely there will be alteration of the hormones leading to the mood swings. And breast tenderness, because hypoxic condition where the estrogen is a potent vasospasm, where slight breast discomfort, and the blotting of abdomen where the progesterone level is declining, and headaches, cramps, fatigue, food cravings, and the acne. These are all normal physiological things that doesn't require as such no treatment. Yes, Udavartini treatment. If it is deteriorating her condition, daily routine activities, there needs an attention. And going furthermore, yes, definitely a menstrual pain needs an attention. You can't like, okay, you deal with a symptom, okay, it's mild pain, you can look into it. No, we can't neglect a simple menstrual pain where it requires an attention. Yes, and prior to that, make sure her food habits and her body weight and height, her BMI is good enough, and she is taking a proper food habits with water intake is sufficient, and her environmental factors is not impacting on her daily routine things, and she is not having a disturbed sleep pattern, because we know Nidra, Ahara, Nidra, and Brahmacharya. These three are very essential, and these are the main pillars of our health. If these are all good enough, and she is having mild to moderate activities, she is not like sedentary lifestyle, these all things are in good enough, but still the lady is experiencing a menstrual pain, then it's needed time to see a doctor. Yes, This is the time she need to approach us, and then comes the picture of Udavartini Yonivapath, where it daily impairing her routine activities, and even on over-the-counter medicine where she take any painkillers or simple methotrexate or whatever it is not subsiding her pain, and definitely a slight pelvic discomfort, and even the pain subside throughout her cycle, maybe even 1 day or 2 to 3 days throughout her menstrual phase, then it needs a attention. Okay, this is the time where nowadays there is one more condition that is called premenstrual syndrome. It becomes nowadays so challenging. The lady will be prior attaining to her cycle, means starting with her cycle, she end up with these sorts of complaints. Yes, definitely it needs an attention. As we know in Ayurveda, Udahavartini is a purely a Vataja. Yonivapath as such 20 is enumerated, and we have innumerable Yonivapaths. But in 20 Yonivapaths, Udahavartini stands first, where without Vata, there won't be any Yonivapaths. Nahi Vata Drute, there is no Yonivapath at all. Keeping that note, any Yonivapath, first line of treatment is Vatahara line of treatment. Whenever you're planning for any Yonivapath line of treatment, first make sure that you will go with the line of treatment as Vatahara line of treatment. Okay, and then later further on, Sneha Sweda, that is what? Sneha Swedha Vastyadi Vatajas Senilapaham. Whatever you plan, it should be with Vatahara line of treatment. Vatavyadi Hara Karmam Vatarthanam Sadahitam, means always in this condition, Vatahara line of treatment holds good. And Vatarthanam Chayoninam Seka Abhyanga Pichukriyaha, that is, which help you do the Seka or Abhyanga with Vatahara Taila or anything that will pacify the Vata. That should be the line of treatment. Why I am telling is, this is simple condition where it needs an attention. A simple Vatahara, any Shulahara line of treatment, or any Vatanulomana, because Udavartana, where Vata has moved upward, you just plan a treatment. Any Vatavyadihara Chikitsa, anything you take it, which is having Anuloma property, and even with any Shula Prashamana, that will cure the disease. And even then, a mild to moderate, it can cure by itself, but even then it is not subsiding. Like simple Shamana Chikitsa, like Inguvachadi DS or Inguvachadi tablet or Koligo tablet, or you go with the classical medications, any Vatahara Kashayas like Gandharva Asthadi Kashaya, yes, and then Lavana Bhaskara Churna, any Shulahara Prashamana Dravyas, you give it, it will immediately subside her pain. Make sure she should not have any pelvic pathology. See, a simple dysmenorrhea, it's a simple primary dysmenorrhea without having any pelvic pathology. With simple line of treatment with Vatanulomana and Shulahara, it can be cured. But you imagine if there is any fibroids or anything that I'll be discussing later, if that is there, then she needs, her approach will be different. Okay, and a simple primary dysmenorrhea, even with the simple Matra Basti, will look into it. Any Vatahara Taila for that matter, because as ma'am rightly said, I'm working on Mustadi Apana Basti and Yeranda Muladi Niruha Basti. Yes, definitely these two does the wonders in Udavartini Yonivapath. Definitely it has its own benefits along with that subsiding of Udavartini Yonivapath. That is a brief note on what exactly a simple menstrual pain, and it needs the attention. And moving furthermore, yes, these are some other condition in relation to menstruation where she needs medical attention, where menstrual disorders may be a scanty flow or a heavy flow, heavy menstrual bleeding, or intermenstrual bleeding, everything abnormal uterine bleeding. Because now, as per FIGO, like International Federation of Obstetric and Gynecology, and ACOG, where abnormal uterine bleeding is considered and dysfunctional uterine bleeding is nowhere, now we are using it. Okay, keeping that any disturbance in her menstrual cycles, maybe abnormal uterine bleeding, you can consider it needs an attention. And PCOS or a PCOD, a spectrum of diseases, it's a multifactorial, it's a hormonal, endocrinal, and the metabolic disorder, where this also needs an attention. Definitely it's having an ovarian factor. When the lady is seeking for fertility, then definitely it has an hamper. Okay, we can PCOS, depending on the symptoms, you can understand maybe anarthava, where complete absence of menstruation, or maybe intermenstrual bleeding, okay, or pittaja asrigdhara you can consider, or a heavy menstrual bleeding, even any sorts of asrigdhara you can consider. That is how the clinical presentation comes in PCOD. Accordingly, you can plan the treatment according to our classical references. And one more thing, in a female, an active reproductive period, one more common gynecological complaints, even though it is related to the urinary symptom, a simple urinary tract infections, if not managed, because genito-urinary systems are one-to-one related. So this also need to be tackled very well if at all the lady encounter during a reproductive period. And a simple pelvic pain and stress related disorder. These are all the things we need to have a countering. Okay. And definitely prior in hand, we need to have, because in school days we have a one concern, that is we have an education, sex education and other thing. Yes, definitely we need to give an awareness about the periods, where a better reproductive health and the greater self-esteem and the confidence and better academic performance, we need to educate at the time of adolescence period, so that the lady will be more aware about her menarche and other things, so that adolescence health, if make it stronger, then we no need to worry. If Rajaswala Paricharya during that, whatever, like light and then Shita and then Snigdha Ahara, Lagu Ahara, because definitely they are also aware, our Acharyas are also aware during the menstrual cycle phase in Rajaswala time, definitely her Agni will be hampered. Keeping that, they say Shali, Mudga, such Yusha preparation need to be given, because she's already, because of Rakta. Rakta is nothing but it is what do you call dasha pranayatanas, it is sustainer of a body. Definitely a blood loss, definitely she will be going with some psychological and the physical tiredness, where and along with that our agni is going for derangement. So keeping that, that is not means like broken earthen pot you take a food, it doesn't mean, take it in a lesser quantity of it, and which is nutritious. Yes, that's what yugda mosha and other thing, like yushas are being given, because sadhyo tarpana is required. So keeping that note, we can practically implement in such a manner. And rest. It's not that isolation. Thinking, yes, definitely that is body sustainer, Rakta, when it is losing, definitely she is getting a uneasiness and the strength will be weakened. So to make her rest and make her rejuvenating throughout, at least during that 3 days, to make her rest, the isolation was there. Not in the sense that she should not move here and there with a restriction. No, it is that let her take and relax, a physical relaxation, so she will feel comfortable and rejuvenated. And going furthermore, in adolescence period, especially watch over her menarche and give an insight into, like, let the girl child were aware that it is not the fine or a penalty. Let her take that as in, what is that, gracefully enter into the adolescence period. And definitely nowadays the rate of CS cervix, okay, and other things are raising. Okay, when you think in the worldwide, it's a 4 out of 10, 4 members will be with the one or the other cervical cancer. Keeping that note, in the worldwide, in India we are in the third, fourth place in cancer CS cervix. Keeping that note, where we have a usage of HPV vaccinations are nowadays available. Yes, at the age of 11 to 12 years, it can be given, where immunization of the CS cervix with HPV vaccinations are very important. Maybe Gardasil or quadrivalent or a bivalent, we can use it. Usually, right ages for girl child is 11 to 12 years. And if not, at least prior exposure to the sexual act. We need to entertain this HPV vaccination, because definitely the girl child is the root cause where she may end up with CS cervix later on. Prior exposure to the sexual act, it will be the right time, because 100% coverage will be there with the vaccination. If it is in the later, definitely only a 40% of the coverage. So keep a note, prior entering to the reproductive or in active sexual life. Prior to that, if immunization is done, definitely, because I'm not going against with Ayurveda or modern. Yes, definitely, whatever advantage and the limitations of our science, we need to inculcate. Keeping that note, the adolescent girl child need to have an awareness about the immunization and generalized health checkup every 6 months once. Don't neglect it. Once she get her cycle, and meanwhile, like 6 months, 7 months, if she is not getting it, please look into the nearby doctor, and the consultation is need of the hour. And definitely one more, like in the developing countries, major thing is worm infestation. So deworming, because as school going children, it's very common the nutritive value maintaining, and definitely they are ended with worm infestation. Make a note of it. Maybe any Krimihara line of treatment, Krimikutara Rasa and other thing can be taken into consideration. And definitely we are like, once again, all the things are comes in the developing countries where anemia is pre-existing. The girl child, if not taken care at the early, maybe she enter into the pregnancy with anemia. So keeping that, and along with that any vitamins or micronutrients deficiency, that also need to be tackled very well in an early age. Otherwise in the later period she will be with deprived of it, and she'll enter with a malnutrition to the pregnancy, and whatever the shreyasi praja we need to attain, there will be difficulty. Keeping that note, in every stage make sure that a nutrition status will be opt. And definitely if at all any emergencies or any menstrual discomfort, she need to be referred where and when and where it's required. Because why I am saying is, a heavy menstrual bleeding in the early period, or what do you call pubertal menorrhagia, is a nightmare, where we can't say like only with Ayurvedic line of treatment we can cure it. Definitely in pubertal menorrhagia or asrigdhara in adolescence period needs an emergency attention and proper evaluation. Keeping that note, I had said like maybe wherever they are the girl child, it need to be evaluated correctly in the prompt effect. And going with specific to today's my topic, like gynecological condition, what and all the things the lady may encounter, the commonly which I had enlisted here. I'll be giving an insight into the disease, and then what approach in Ayurvedic parlance we can go for it. Actually I already commented on dysmenorrhea as the painful menstruation. Yes, Vatahara line of treatment and the Shulahara line of treatment is need of the hour, and even Basti will do wonder in dysmenorrhea or Udavartini Onivapath, especially in counter to add as even simple Dashamula Kshirabastis. Okay, Dashamula Vata Kafahara, definitely it having an impact, or simple Dashamula Kashaya or Kulatta Kashaya. Yes, these are all the some sort of drugs you can even use it. Or simple dysmenorrhea or a simple primary dysmenorrhea, where you can even use the line of treatment with simple Matra Basti with any Brahmana Taila for that matter, maybe a Dhanvantara Tailam, or maybe with Kshirabastis, or what do you call Mahanarayana Taila, all Vataha line of treatment. You can adopt it in Udavartini, Yonivapath, definitely, and the definitive treatment you will be getting it. Okay, that is the thing. And definitely the follow-ups are required, but make a note, dysmenorrhea compared to modern, we can treat it opt. And going furthermore, because treating is easy, we can treat everything and everything. But the thing is, what definitive treatment we can give it? Yes, that comes the dysmenorrhea. And going furthermore, one more thing where most patients will fed up with, and they will move into our Ayurvedic fraternity. Such condition is amenorrhea or anarthava. Yes, anarthava, maybe because of any kshaya of arthava, or maybe avarana of it, where the lady may experience anarthava, where she needs in once again a proper evaluation. Okay, any systemic illness, that means maybe any anemia, that all those things may leading to that, or maybe with what do you say, our nutrition status are not good, that also may be impact of amenorrhea. But going specific to the our gynecological parlance, any like first do the simple scan and look for any pelvic pathology. If there is any PCOD, or maybe any ovarian cyst, or a huge fibroid, okay, these are all the common complaints. The lady may end up with amenorrhea or irregularity of cycles. Okay, maybe heavy menstrual bleeding or anarthava. And furthermore, even you look into her hormonal assay, maybe hyperprolactin levels. Yes, all those things may also have an impact leading to amenorrhea. In a simple line, how to evaluate. And later on proper evaluation or whatever it is, make a note, our approach is different. You do n number of investigations, but still our approach remains the same. Why? Because even though amenorrhea, only thing we need to rule out is she is not pregnant. That is the only thing we should rule out. And later you put the line of treatment as our Acharya has mentioned for Anarthava. Yes, all Vamana, Virechana and Basti holds good in Anarthava, but This is a one crucial trick, or by practice it will come. Anarthava. Definitely we know Anarthava like Agni Dushti. When you think Uttarottara Dhatu Pariniti, when Rasadhatu is impaired, the Upadhatu itself is Arthava and Stanya, where definitely the Arthava will be getting deranged. Keeping that in a mind, always keep a note. Treating any disease for that matter, Agni Dushti need to be taken consider of. And later, depending on the flow pattern, definitely rasabahulya vikaras are there, or rasakshayaja vikaras are there. And then where anarthava is persisting, vamana will look after better. Okay, when rasapradosha vikaras and other thing, vamana will be the first line of treatment. When the scanty flow and other things are there, you can treat with vamana, and followed by pitta vardaka, or what do you say, shonita janana dravyas. You can give it later on. First of all, do kafahara line of treatment, and then, or vata kafahara line of treatment, and then plan for, you know, artava janana dravyas. Definitely it does wonders, especially in amenorrhea. Maybe a jyotishmati churna alone will look after the amenorrheic conditions, or maybe Rajapravartini Vati or Lashunadi Vati, okay, or even Lashuna Churna Prayoga, okay, or in food habits, or Tilataila Prayoga as Shamana Sneha. All those things in Shamana Chikitsa, you can do wonders with amenorrhea management. And make sure that in her food habits also there will be cut off glycemic index levels, because definitely the PCOD and other things, where the insulin in the obesity there will be insulin resistance and other thing. On the counterpart, a healthy lifestyle and maintaining the biological clock, we need to convey to the girl or a lady who is encountering with amenorrhea. Okay, this is in brief about it. And in daily routine, in the patya aharas, because patya sati gadartasya kim aushadam nishevanat, patya asati gadartasya kim aushadam nishevanat. If they practice a healthy food habits, there no need of medicines. Even though you give a healthy food habits, there won't be any medicines. If she is not at all following, even though you give plenty of medicine, it doesn't serve it. Keeping that in amenorrhea, make sure that there will be caloric intake, especially with the carbs, will be cut off, and the protein diet she can have it, and minimal mild to moderate exercise is need of the hour, because we know that hormonal conversion, peripheral aromatization should happen, means definitely the fat metabolism should happen. Fat should burn so that the estrogen levels will produced well. Keeping that in a note, to maintain that peripheral aromatization, we need to have a regular exercise, and maintaining of our body mass indexes need of the hour. Along with any disease for that matter, maintaining a healthy lifestyle, that means the biological clock shouldn't be hampered, and proper water intake, as WHO recommends, 20 kg of body weight, minimum of 1 liter of water, and sleep pattern, minimum 6 hours of sleep per day with sound sleep. These are all the basic things the lady need to have it. Okay, and going with heavy menstrual bleeding, yes, definitely heavy menstrual bleeding or with amenorrhea, there's once again the condition here, pitta, like pitta, the quality of pitta is getting increased. So pitta shamanartha, even though some extent vamana will be beneficial, but first line of treatment always go with pitta shamana. When you think of shodhana, think of virechana in heavy menstrual bleeding, maybe intermenstrual bleeding or anything. When the heavy menstrual is there, don't think of vamana first, think of virechana first. Because pitta vriddhi is there, where you want to make shamana of pitta and indirectly the artava shamana, where in that condition go with virechana, where it does pitta shamana as a whole. And later we know that artavam agneyatvam. Keep a note, whatever the line of treatment you plan after virechana, try to put on Agneya Dravya Prayoga to maintain a normal menstrual cycle. And along with that, in Anarthava is also same thing. Vamana you can plan, and along with that, Vaitarana Basti will have an excellent result in relation to amenorrhea. Okay, it's a Tikshna Basti Prayoga, or with Gomutra you can use it. These are all very much Tikshna Ushna Prayoga should be there in Anarthava. But in heavy menstrual bleeding or in Asrigdhara, already Pradara is so much heavy bleeding. So you can't plan a Vamana or Tikshna Ushna Prayoga. First, do Shamana of it. Do the Pitta Shamana, and later try to only increase Artava Janana or Artava Shodhana and followed by Janana line of treatment. Okay. And make sure heavy menstrual bleeding, once again I'm talking about where her general condition is deteriorating, because heavy menstrual, once again Rakta is what you call sustainer of the body. Definitely her general condition need to be encountered, especially in heavy menstrual bleeding. Here make sure her Rakta Dhatu should not go for Kshaya. Keeping that, we say in modern, go for Stambhana line of treatment, and maybe with what do you call Chandrakala Rasa, okay, or Bolabadda Rasa or Bolabadda Parpati, that also required. And along with that Shodhana, you can plan, and along with Patrangasava, okay, Mushali Kadiradi Kashayam or Pradharantaka Rasa. These are some things where immediately you need to go with Stambhana line of treatment, and later you can need to give it hematinics where Rakta Dhatu should be maintained. So you can give any Purnama Mandura or Abraloha, some which rejuvenating her Rakta Dhatu or Rakta Prasadana line of treatment, Manjishta Prayoga, all those things, you can do it in heavy menstrual bleeding. Okay, this is the approach. Do first Shodhana as Virechana in heavy menstrual bleeding, and later Stambhana of Rakta Dhatu, means the heavy menstrual bleeding, and later plan to maintain a general condition because anemia need to be corrected. So that is the line of treatment. Even then it is not subsiding, look for the evaluation properly and look for the cause, and accordingly you can treat. If subserosal fibroid more than 5 centimeter, it's a surgical indication. You can't do anything with Ayurvedic balance. You can only give the life expectancy, and the quality of this thing can be improved, but don't give a promising result. Even 8 centimeter 9 centimeter of fibroid, definitive treatment, definitely it is too difficult. But up to the 3 to 4 centimeter of fibroid, yes, we can try it on, and we can definitely have a intervention there. So know your limitation and know where exactly you can do the flora. These all is there in your hand. And similar kind, the fibroid uterus. That's what I am talking about. Yes, intramural and the subserous, based on the location and other thing, Garbhashaya Granthi, where Granthivat Chikitsa, Grathanat Granthihi. So it's a benign lesion where you can have a line, and required, it depends. Fibroid uterus management depends whether she is seeking for a fertility or she is already in the perimenopause or a menopause age group. First decide where exactly she is. If she is seeking for fertility, 3 to 4 centimeter, try with Ayurvedic line of treatment where Basti. Once again, the Lekana Bastis with Tutta Prayoga and other thing, Lekana Kasisa Basma and other thing, you can use it in the Lekana Dravya as such in Kalka Dravyas. That is having excellent result in fibroid uterus, okay, or Kshara Thaila and other thing, you can use it in the fibroid uterus. And along with that, once again, a Vaitarana Tikshna Basti Prayogas or Eranda Muladini Ruha. These all having wonders. It definitely help in the case of fibroid uterus. Don't go with Balya Brahmana Bastis. Go here with Vaitarana Basti or Shodhana Bastis, or even you can call it as Lekana Basti Prayoga. It has a good result. And along with that, you can plan Vamana Virechana depending on the other clinical symptoms what the lady will be exhibiting. And definitely it should be Grantivat Chikitsa, where you can go with Varunadi Grita or Varuna Panchatiktaka Gritas will have definitive treatment. And along with that, even you can go with Kanchanara Gugulu and other and Shiva Gutikas. So such prayogas, you can do it in the case of fibroid uterus. And next, moving on to the major concern where our Ayurvedic Sriroga is flourishing nowadays, especially with the infertility. Yes, definitely infertility is once again a multifactorial based on the reasons our approach will differs. We know it's also multi, like Yoni Doshat, Manaso Abhitapat, Shukra Astra Artava Vihara Doshat, Ahara Vihara Doshat, everything is there. But according to the cause, treat her, and later on evaluation, if it is an ovarian factor, maybe a PCOD or anovulatory cycles, definitely we can handle it. And going furthermore, where the tubal blocks and other things is there, to the extent around 50 to 60%, we can manage the tubal blocks and other thing along with Uttarabasti Prayoga, where our science holds good. But it's just a 50 to 60%. I won't say it is 100%. Definitely we can tackle that. And definitely in the modern science, when they think of, they have only like OC pills and other thing oral contraceptive, estrogen, progesterone. Only with that they should play a game when they want a conservative line of treatment. Otherwise, they need to go when the tubal factor is there. They have to go with IVF and other thing. But where we have a Uttarabasti with the excellent treatment, we can try with it. And endometrial factor is also same thing as a supportive, a multivitamin or an antioxidant. They can give a supplementation for endometrial factor as such. If at all endometriotic cyst or something, they can plan with excision. But in Ayurveda, we have an Uttarabasti where you can plan it. And along with that, the Prayoga of Kshirabastis. Kshirabasti Prayoga will definitely having a result on endometrial factors, especially with the Kshirabasti with Yashti Madhu. Yes, Yashti Madhu is definitely helping for the proliferation and it prepares the endometrium for its normal implantation bedding. So these are all the things depending on the causative factor, our line of treatment varies. That is, infertility is also a such condition. Like when you go with what do you call Garbhadana Samskar as a preconception, what all the Shodhanas like Vamana Virechana Basti, according to the requirement of the patient, you can plan it. And the Rasayana Prayogas, especially maybe Amalaki Rasayana or Jirakadi Avalehya, any like Balya Brahmana line of treatment, especially who was seeking for fertility, indirectly helps for fertilization other than treating the pathology itself. And going furthermore, a pelvic organ prolapse is the one thing the lady maybe a dushprajata, difficult labor if she would have experienced, or maybe the laxity of the perineal muscles, levatorani muscles would have been laxed, or the uterine supports would have been lost. Where to strengthen it, where we have Yoni Abhyanga, Yoni Parisheka, and Yoni Pichu, and along with that, where Shamana Chikitsas with Changeryadigritha or any Balya Brahmana Gritas can be used in pelvic organ prolapse and Kshira Dhuma. Okay, and even the Prayoga of Yamaka Snehas, you can make a use of it and you can help it in the case of pelvic organ prolapse in the grade UV fold prolapse, utrovesical fold prolapse of grade 1 and 2. Yes, definitely we have a good results, and along with that, Kegel's exercise will definitely help you the case of pelvic organ prolapse. And going furthermore with reproductive infections, yes, definitely the Sthanika Chikitsa will come into the picture where Yoni Prakshalana and Pichu and the Kshara Karma, especially in the reproductive infectious condition, and even Varti Prayoga, it will be beneficial. If you simple like Pitta Chayoni Vapath, where even simple Nimbakashaya or Panchavalkala, especially Panchavalkala is Pittahara line of treatment, that wash, or maybe Aragbuddha Kashaya wash, like vaginal douching, can be helpful to minimize the secretions of the vaginal, abnormal vaginal discharge, and it maintains the healthy flora of the vagina and the cervix. And along with that, a pichu, maybe with Yashtimadu Thaila or Dhurvadigrita, or even simple Changeryadigritha, all those things will help in the condition of any vaginal infections to tackle it. And along with that, yes, Anushastra is very much this thing where in a modern where recurrent white discharge, abnormal vaginal discharge with cervical ectopia or erosions is there, where in Ayurveda, like in modern, they have a cryosurgery and other thing. Following the cryosurgery is also the cautery or whatever it is, the lady will be experiencing once again the profuse white discharge and other thing as a complication. Where in Ayurveda, we have a Kshara Karma and the Agni Karma in the cervical erosion, where that is called Garbhashay Grivagata Vrana, where if you do it with the cautery, means that is what Kshara Prayoga, with Ayurvedic Kshara Prayoga, maybe a simple, we always think Shara means Apamarga Kshara. No, we have a Prayoga of Palashak Kshara and then Karanjak Kshara, Apamarga Kshara, and even Arka Kshara. These all having, depending on the severity of the cervical erosion or unhealthiness of the cervix, along with even you imagine if she is having a simple cervical polyp, or maybe with cervical ectopy, there is an erosion, or maybe with Nabothian cyst. In such the chronic cervicitis, in such condition, even though we know like Pitta and Raktas are interrelated, even though Pitta is there, like erosion area, even Kshara can be given and neutralized with Nimbus Farasa, where it acts as Prasadana over there. So keeping that and definitive result to make it a healthy cervix, we can use that Kshara Prayoga in cervical erosion. And going furthermore, like general like urinary tract infection very common, where the borderline bacillus is the one which prevent us the vaginal infection in the active reproductive period. And when she experienced the birth and prior she attained the menarche and followed the menopause, the activity of borderline bacillus is not there to maintain the pH of value of vagina. And along with that adjacent structure where the urethra or urethral meatus one to one is related, definitely the lady may encounter the recurrent UTI and other things, where we have like Chandraprabhavati or Ushirasava or Chandanasava to soothe her urinary system. But along with that, the usage of Mutra Margagata Uttarabasti, where like it's similar to that of bladder wash, where you can use with the help of Panchavalkala Kwata and other thing. Definitely we have a good results with chronic cystitis or urinary tract infection to overcome. These are all the common gynecological complaints what the lady will be encountered throughout her reproductive age group. And prior going one more topic, as I already said, Rajaswala Paricharya and then Garbhini Paricharya comes next, the major thing where a preconceptional care. We should make a note that every pregnancy should be planned and it should be by choice, not by chance. So in Ayurveda, nowadays, whatever we say preconception care and other thing and the counseling, genetic screening, yes, even olden days we have that concept, proper age of marriage and other thing. They shouldn't have marriage with the same clan, kula or something. That is what nowadays we are talking about genetic counseling and the screening. Don't go with what do you call consanguinity and other thing. But olden days also that concept was there, and early marriages and other things were not indicated in those days also. That is proper age of marriage and the conception was being dealt in the previous also following that. That is Shodhana, prior planning for a conception, the preconception, and the following Garbhadana Vidhi, and Masanu Masika Garbhini Paricharya. This is excellent to get a Shreyasi Praja. And whatever the do's and don'ts beautifully mentioned in our classics that need to be followed. And then Manasika Satvika Ahara, it's what mother thinks. Mathur Ahara Vihara, Shadbhavas, when you think of Mathur Ahara Vihara, is also having an impact on growth and development of the baby. So in this regard, after Rajaswala Paricharya, you had taken care well, and the gynecological complaints you tackled well. And when she is entering to the major life, that is major this thing, pregnancy or Garbhini Paricharya, that needs an concern. And in modern, they say education and the counseling, genetic screening, and other nutrient supplementation. And in Ayurveda also, we have that concept where Garbhini Paricharya is being explained. It is that we preparing the pregnancy for Sukha Prasava, and she should be peacefully there in physical as well as mentally. Her growth and development will be at opt. If she follows whatever Ahara, Vihara, and Aushadha, and what are all the things they had explained, if the lady follows during Garbhini Paricharya, definitely she can achieve the Shreyasi Praja. Not only attaining the pregnancy and giving birth to a child, and following that also, like Sutika Paricharya is the one more beautiful thing where her anatomical and physiological changes throughout her pregnancy, what are all the deranged that need to be reverted back, because Shunya Sharira, we say Sutika as Shunya Sharira, that 1.5 month or a 4th month or 5th month, according to different on Punarartava Gamana, we have a reference as Sutika, where proper care and nourishment in Sutika is also very much essential, because she need to revert back both physically and mentally to her normal pregnancy, pre-pregnancy stata. So following that, and to overcome her, what do you call, any infections and other thing, isolation, whatever nowadays we say labor room and other thing, we have a previous era, that is Sudhika Gara, and proper moral support, at least at the time of delivery, and Abhyantara Upakarmas, like maybe Sthanika Abhyanga for the lower abdomen and the thighs, and Bahya Upakramas, like usage of, what do you call, Pichus or Yoni Purana or Yoni Parisheka, if at all normal delivery, the episiotomy, wound care and other thing, and breast care, definitely nowadays we say like galactogogues and other thing, and the nutritious food and other thing that need to be taken care of, shatavari and other preparations, and proper care of the breast. And along with that, we need to make her psychologically happier, because we know that psychological impact will definitely impair her lactation insufficiency. Keeping that note, we need to have an overall assessment of that, and definitely Sutika Paricharya will look after that changes whatever she had undergone, and if she follows proper, definitely it can be taken care. Why? Because yes, she is a mother of nation. That's what she is requesting: protect me from the dying from during childbirth, so that she will protect her progeny. Because if you care for one, it will be fair for two. And definitely in Ayurveda, I mean in our classics, we have a reference: asmin nek sthita pado bhavetyebhyam yamakshaye. In Kashyapa, he rightly says the pregnant lady will be under the one leg will be in Ihaloka and one leg will be in Paraloka or in Yamaloka. So utmost care and concern to be given for a pregnant lady, so that she will give a healthy progeny. Because whatever you plan during pregnancy, it should have a two major concern. One is to protect the pregnant lady, and at the same time vardana of the fetus. That is what Kashyapa rightly said in Antarvatni Chikitsa. Whatever you plan, Sukshma Chikitsam Karyami, you do plan anything for a pregnant lady, but it should do the nourishment, it should do the rakshana of the nari, that is pregnant lady, and vardana of shishu or a fetus. That is the aim and objective of pregnancy. Because every mother counts, and every woman's life matters, because she is a sustainer of a family and the society. And not only during her Rajaswala Paricharya, or maybe during her pregnancy, or maybe in Sutika Paricharya, and at the same time she will be entering to the one more crucial lifespan changes, that is the geriatric care of a woman, that is Rajo Nivritti. Yes, definitely during that time, definitely she'll be ending with so many psychological and physical variation in her life. Maybe a simple mood swings, or maybe physically she'll be changing, where she'll be attaining hormonal imbalance and other thing, hot flushes and other thing. Definitely she needs an attention and a care at this time also. So giving a Naimittika, Ajastika and Kami Rasayana, depending on the requirement for Rasayana Prayoga, and if at all any like disorders, definitely like osteoporosis and other things she'll be encountering, because estrogen, hypoestrogenic level, definitely it will having an impact on calcium synthesis, where definitely she end up with early osteoporotic changes. Definitely she need a Shodhana Karma or Basti Prayoga, local Sthanika Bastis like Janu Basti or something, whichever the joints and other thing is compromising. Accordingly, we plan a local treatment, or maybe Ekamolika Prayoga with simple Vayastapana Gana Dravyas or Jivaniya Dravyas like even Guduchi, Bala, Ashwagandha, Shatavari. These four churnas, if you make it and use as a Kshirapaka, definitely it acts as a phytoestrogen and will look after the hypoestrogenic levels, and she won't be falling in early age. And definitely Ahara, Vihara and Vichara, whatever it is, our baseline, ita ahara, mita ahara, all those things, and Ruta book, seasonal food habits and other things, everything counts for a healthiness of a woman. Okay, this is the major thing and attention required throughout her four major lifespan, that is Rajaswala, Garbhini Paricharya, Sutika Paricharya, and even need to be taken care during Rajaswala, because Vayasthapana, even though Rasayana Prayoga is mentioned, Purve Vayasi Madhyeva, that is, it need to be taken at the earliest, try to start it. Whatever our Ayurvedic basic principles, Sadvritas have been explained, that need to be followed, so that she will be like, because age is an advancing, we can't stop it, time will definitely pass off. It's an attitude. See, age is an attitude. How you live it, it's within us. And definitely growing old happens in mind, but reshaping of aging process is within our control. So what I need to say is, our acharyas have beautifully explained the classical references. Each and every corner, they given an importance to all, not only in a female concern, in a overall general health also, but keeping the three as a major thing. They had explained from the Rajaswala to the Rajo Nivritti. Everything has been beautifully explained. It's only in our hand how we overcome that. Keeping that, build power to avoid fall in the future. Means take a priority steps to encounter whatever the changes, physiological things or pathological things happening. Do accordingly. Early detection and early management and prevention is better than cure. Keeping that note, follow each and every step of it, so that you can build power, so that you won't fall in the future. In this regard, yes, Ayurveda, we need to think of not only for a wellness, even for a illness we should think, so that our health will be maintained to the core. In this regard, I thank Hetal Dava madam for giving me an opportunity to give my insight on gynecological complaints, not only in all the stages of life, what and all the lady, how she can encounter with a short notice, with a short duration of 1 hour. I try to complete the topic. And if any questions or queries, I am open for it. If any questions or queries, let me please.
जी, बहुत बहुत धन्यवाद. एक्स्ट्रा ऑर्डिनरी वंदे
Thank you.
भारत,
Thanक यू
वंदे
मैम.
भारत प्रेजेंटेशन.
थैंक यू मैम.
और
थैंक यू.
बहुत ही बढ़िया तरीके से एवरी माइन्यूट माइन्यूट पॉइंट्स को भी आपने बहुत अच्छी तरीके से वहाँ डिपिक्ट किया, और मैं समझती हूँ कि ये एक्सेलेंट प्रेजेंटेशन
थैंक यू.
हमारे बहुत सारे प्रतिभागियों को अपनी अपने स्थान पर अपने रोगियों की सेवा करने के लिए, उनकी चिकित्सा करने के लिए, बहुत ज़्यादा बेहतर अपने आप को निखारने के लिए अच्छा रहेगा.
थैंक यू.
आपने तो रस रस की चिकित्सा में जैसे ही लंगन बोला ना,
यस मैम.
वहीं से मेरे को समझ में आ गया था कि आगे की गाड़ी कैसे जाने वाली है. बहुत ही बढ़िया. और
थैंक यू.
मैं सभी पार्टिसिपेंट से कहना चाहूँगी कि इनिशियली जो हमारे स्पीकर थे डॉक्टर गायत्री मैम, मुझे पता है जल्दी जल्दी में नाम नहीं याद आया, और मैंने सोचा ढूंढूंगी तब तक देर हो जाएगी. तो डॉक्टर गायत्री जी क्षमा करिएगा, मैं शुरुआत में आपका नाम नहीं ले पाई, कि आपने ही डॉक्टर नंदा का नाम सजेस्ट किया, तो आपका भी धन्यवाद है कि आपने काफ़ी कोशिश की. मैडम ने हाफ डे तक तो कि नहीं नहीं मैं ही कर दूंगी, मुझे लगा कि नहीं ये काबू से बाहर है, तो फिर उन्होंने आपका नाम सजेस्ट किया.
Thank you, ma'am. I am blessed because I'm proud student of her. I am really blessed to be there, ma'am. Thank you.
जी
Thank
जी
you so
जी.
much. If any questions, I'm open for it, ma'am. If any discussion,
जिसका स्टूडेंट ऐसा है उस मैडम को सुनने का तो कितना मजा आएगा.
definitely.
जी जी जी, बहुत बहुत धन्यवाद. और डॉक्टर साहब, बेटा आप चैट बॉक्स में देखेंगे एक बार,
Chat box, ma'am, one sec. Let
देखिए
me
एक बार.
see. One second. You can pin the message. Would you kindly repeat the Rasayana Yoga after menopause? Yes, I got it's moving, but I'll try to. They're asking for Rasayana Prayoga following a menopause. They're requesting for it. Yes, definitely, ma'am. Rasayana, yes, see, general Rasayana will be the major thing, and depending on, because see, that is the age of menopause, 45 to 50 years, definitely they will be having a systemic illness also. Keeping considering that, Rasayana we can give, we may a diabetic or something, definitely a pruritus vulva, if we consider, there will be diabetes is there, there will be worsening. So keeping all in note, generally like Amalaki Rasayana as an endothelial level to rejuvenating, Rasayana Amalaki will look after like anything. And even Agastya Haritaki, even though it is not the, don't look into the Adhikara, because I won't be going in specific to Adhikara of the disease as such. Even Agastya Haritaki will look after very well, especially in the reproductive concern, especially where the heart bubble and the urinary disturbance and other thing, where Vata Anulomana is the thing, the blotting of abdomen or any abdominal discomfort or other thing, especially following a menopause, the lady will be encountering often, that will be looked after with that. And general individual Ekamulika Prayogas like Guduchi, and then what do you call Shatavari, Ashwagandha, and then Bala. Along with that, Yashti Madhu. These all four in combinations. You can make a churna of it, fine powder, mix it in an equal quantity, make it as a Kshira Prayoga in a regular. It's not a one-day game. Make a note. It's not the one-day deal. She need to be followed. Like we know that definitely we will be encounter that. Even though I don't want to become an age-old person, definitely I'll be entering into the period of Rajo Nivritti. But how gracefully I'll be entering into it, and now I'll be accepting that. That is what majorly counts. That is your sattva, how strong it is, accordingly it will go. And that kshira, usually I'll practice my generally, that is that kshira prayoga, that is kshira yoga, will definitely having an excellent result, but it should need to be regular practice. It's not only a 1 day or a 1 week deal. She need to practice on the regular basis. Definitely it is an excellent in treating that. And then up to how much centimeter fibroid and cyst we can give Shamana Chikitsa, ma'am? Yes, once again, it is a concern. Sometimes at slight one irregular cycles, they may go with a scan and they may come with a finding of ovarian cyst with a size of 3 to 4 centimeter or 5 centimeter. For my clinical practice, I had come across, because mine is a 9th year running as a clinical practitioner following a postgraduate. In my practice, I can tell you like 2 to 3 centimeter of the fibroid, we can aramsely treat it. With even simple what you call lekana bastis in the virechana, we can optly treat with tiktaka or varunadigra tiktaka gritas, any tiktaka gritas you can plan it with virechana, it definitive treatment. And along with that Shamana Chikitsa, when you think of it, that's what, like surgery you're avoiding. That's what I mean in Shamana Chikitsa, not only the oral preparation, because I can't say like how exactly the Shodhana therapy help it, but definitive treatment we are getting with the help of Shodhana. And going with ovarian cyst, yes, I had documentary of around 6 cases of ovarian cyst with a size of 4 to 5 centimeter, where a simple virechana followed by Shamana like Panchatikta Gugulu Gritas, Kalpana as a Shamana Sneha I had given for over a period of 2 to 3 months. I had given excellent result. In the consecutive next 3 months of follow-up, the lady is devoid of ovarian cyst. But I won't guarantee it. It will happen in all the patients, but definitely with 3 to 4 centimeter at the large ovarian cyst, you can try it. But always be conscious. You will be under proper follow-up with USG guidelines, because there is every chance of torsion. Okay, that is also need of the hour. You need to have a concern of that. Proper follow-up and proper managing, because ovarian cyst is such a thing. Even though it looks simple, it may end up with torsion of the ovaries. That will be, it is a surgical emergency. You can't do it, because I had experienced one of my student who is taking a treatment of 3 centimeter of right ovarian cyst. Yes, the size was declining around 1.8 and the 2 centimeter around. But she once again started with one more other side, because hormones, it's not under my control, where she end up with once again with a 3 to 4 centimeter of another left ovaries. And then one fine day she end up with sudden torsion and acute abdomen pain, and it went up with, we need to remove the one-sided ovaries along with cyst. It all how crucially and how follow-up you do it, definitely you can think of it. Okay. Kashtartava, that is moved up. One sec. Matra Basti, what we have to use? Ingu vachadi may cause burning and mukapaka sometime. Ma'am is Kashtartava. If patient is having Pittanubandha, that time, which kapha and Matra Basti, Kalpa or Matra Basti can be used. See, Gandharva Astadi Kashaya does wonder, because even with a period of what do you call 2 sittings, 2 months follow-up only, I had get an excellent result with that thing, with Gandharva Astadi Kashaya, or Patola Katarohinyadi Kashaya is also some extent help in the case of that. Also, don't look into the adhikara of the Vyadi. Okay, that will definitely help it. And even simple external abdominal pack with like Eranda Thaila, lower abdomen, this all looks like what home remedies, but still it is an excellent. And any Brahmana Thaila for that matter, like Basti Thaila has been asked probably, like Dhanvantara Thaila, Mahanarayana Thaila, you can excel. And even Shatavari Grita, you can use it. And even Sahacharadi Thaila, you can use it. Any Vatahara line of Kashayas or Vatahara line of this thing, you can, Thailas or Grita Prayoga, you can use it for the preparation of Matra Basti. And along with that, even simple Yogaraj, Mahayogaraja Gugulu will be giving excellent result in this thing, Kashtatava. And along with that, Dhanvantara Gulika. I forgot that. Dhanvantara Gulika is excellent in treating it. Okay.
बहुत बहुत धन्यवाद डॉक्टर। एक ने किसी ने हैंड रेज किया है, 1 मिनट।
नमस्ते मैडम।
जी हाँ जी हाँ जी
Madam, yes.
Namaste madam, wonderful session, and thank you madam for the team also madam.
Yeah.
And I just wanted to know hypothyroidism in fertile period. How can we manage?
Ma'am, repeat
and
once again.
How can we manage hypothyroidism during fertile period? And if she conceives and during pregnancy, how can we proceed?
Yes, ma'am.
According to Ayurveda.
Yeah,
According to Ayurveda.
sure. I understood.
Thank you, madam.
Yes, ma'am. Ma'am, thyroid, definitely see, this is like new recommendation. Definitely when we think of it, is and other
Yeah,
things.
and can we avoid all those L-troxine and all those thyronorm and everything?
Fine. I'll be. Yes, ma'am. See, one thing is demanding. How the body demands, we don't know. And definitely when you think of hypothyroidism, that's what planned pregnancy, then we have a counter where we can think of like giving a virechana with Varunadigrita. Once again, because Tiktaka Gritas are excellent here, that you can plan it, or even Mahakalyanaka Grita is also fine, even though the Adhikara is not that. It is having a good result with thyroid dysfunction. And following that, Varun, like Kanchanara Guggulu or with Shiva Gudika, you can use it in a prior planning so that you can minimize the dosage. Keep a note, if she is minimal dose of 12.5 and 25 microgram, you can withdraw it. But, and even Amsapadhyadi Kashaya is excellent in thyroid dysfunction. But when you, in the fertility period, she already become a pregnant. See, our Akashyapa only rightly says, up to 4 months, you should not give any sorts of medicaments. Okay, only Aushadha Prayoga should not be there and Ahara Prayoga can be done. But try to avoid the cabbage and other thing. Definitely that is a source of, they are telling hypothyroidism. But still, frankly speaking, limitation stands there. Pregnancy, I won't say that don't entertain like Ayurvedic medication as such. We can't give you Kashaya Prayogas, and because Karshana line of treatment is not indicated during pregnancy. So what I insist is even following a proper Garbhini Paricharya throughout. Along with that, make a note, L-troxin or whatever is, hypothyroidism is there because growth and development of the brain will be under this thing. I can't take a chance, and definitely I'll be relying on the modern science, and throughout the pregnancy, if it requires, depending on the ranges, it is in the upper limit of 4 to 5. Okay, I'll wait and watch. No need of only Garbhini Paricharya will look after it. But if at all it is going beyond that limit, okay, 2, 3 or 1, it is going beyond subnormal levels, then definitely I need to rely on subclinical hypothyroidism, need to rely on, because I can't take a chance with the development of brain development of the one baby which is going to newborn, right? That only I can tell you in the clinical practice. Definitely I'll go with the combination, because where our limitation is there, we need to accept the other signs also. Yes, but prior pregnancy, if at all you know that she is a hypothyroidism, treat with our line, at least minimize the dosage, and then she can plan for pregnancy.
बिल्कुल सही बताया डॉक्टर साहब.
Thank you. And can you please repeat the till how, if they have given like 25 mcg or 50 mcg or 125?
It's in guidelines is there for a thyroid, like that will be, endocrinologist will be deciding it. But still, even the upper limit of normal is there, the pregnancy is a demanding one for a thyroid. Definitely they will be putting for, even though it is a normal limits of upper limit of normal, they will be putting you on lower dose of 12.5 microgram or 25 microgram, depending on the endocrinologist, they will be putting into that, or a physician who is treating them. But it's definitely required, because the growth and development of the brain, it shouldn't get hammered, because myelinization will be happening, so it requires. So I don't want to go away from that.
Have you treated, madam, without have you stopped L-troxin and
No,
have you
during
taken?
pregnancy I won't, ma'am. During pregnancy I won't. But post delivery and even like prior planning a pregnancy, if at all they are on the 100 microgram or other things, I had reduced to the level of 50 to the extent, or 25. That is a great thing, what deal, where treating that to the extent of 100 to 50 getting down is a, according to me, it's a achievement. But following a delivery, throughout the pregnancy, I won't take a chance, ma'am, because that's what I said. Care for one, fair for two. I don't want to go play with the life of a baby and thing, because we don't know the consequence, what later happens. I won't be saying rely not on samhitas. Yes, definitely we do have, because our acharyas only says up to 4th month, don't give anything. Ahara prayoga need to be there, but we can't take a chance, right?
So, madam, after post delivery, can we try and can we stop?
Yeah, definitely. There is many consequences that even the post delivery, automatically the levels will come to the normal. First thing, as a physiological variation, and later, if at all any variation is there, our kashayas or avashodhana will look after, and even many patients are without any hypothyroid medications presently.
Okay, madam. Thank you, madam.
Yep.
And how about hot flushes, madam?
Yes, hot flushes. Yeah, just now that many had kept on the dosha pramukhya. Dosha is there, like when pitta pradhana. We know that which doshas are there in the perimenopause. It will become as a pitta pradhana. Well, definitely all Shita Upakramas, whatever you want to plan, you plan, ma'am. Definitely she will get a result. A simple, what is the Sari Vadyasava or Ushirasava, Chandanasava will look after like anything.
But there is one lady, madam, she, since 4 or 5 years, she complains of hot flushes. When she takes medicine, she'll be feeling better.
Definitely like that. No, it is like a physiological thing. Yes, I can't stop the, what do you call, degeneration. Especially the graying of hair, how much extent you put a coloring, it will be there. And later, definitely it will go. Age is a remarkable one where I can't able to stop the aging. But definitely when she want that optimum result, she should be on the Rasayana or whatever you give medicaments.
Yeah, that's what. Usually hot flushes maximum 6 months to 2 years or something I have seen.
Ma'am,
But
even
this
though it is
lady,
there, it is an individualistic. I can't say that they will be experiencing only at this point. After 60 or 70 years plus, they won't be. No, I can't say it. I don't know how our body responds. So
okay,
we
thank
can't
you, madam.
interpret that.
Okay, thank you, madam.
Yes.
Thank you, team, man.
Yeah.
हाँ जी, बहुत बहुत धन्यवाद डॉक्टर साहब। और ये मैं सभी पार्टिसिपेंट्स को भी एक बार फिर से वही बात दोहराना चाहूंगी जो डॉक्टर साहब ने बहुत अच्छी तरह से क्लियर कर दी। हम यहाँ राष्ट्रीय आयुर्वेद संस्थान में एक स्थानिक चिकित्सा का 45 डेज का एक सर्टिफिकेट कोर्स चला रहे हैं। वहाँ भी बहुत सारे बच्चे हमारी जो यहाँ कोर्स ज्वाइन करते हैं, राष्ट्रीय आयुर्वेद संस्थान की वेबसाइट पे इसका इंफॉर्मेशन आ जाती है कि नाउ वी आर गोइंग टू स्टार्ट अ बैच एक्सेट्रा। तो उसमें भी बच्चे पूछते हैं। तो ये बात हमें सभी पार्टिसिपेंट में सभी डॉक्टर्स को, चिकित्सक को बहुत ज़्यादा किन ऑब्जर्वेशन से, किन ऐसे ध्यान दे के समझने की ज़रूरत है कि जब भी आप ऐसा कुछ सोचना चाहे ना, तो सबसे पहले अपने आप को उस जगह पे रखिए कि पेशेंट मैं हूँ। आपको बहुत अच्छे आइडिया आएंगे।
Yes.
तो इसलिए
Yes.
मैं ऐसा करती हूँ बहुत सारी जगह पे कि पेशेंट मैं हूँ, मैं सोई हुई हूँ यहाँ, अब क्या होना चाहिए। तो और दूसरा कि मेरे टीचर्स ने जो भी मुझे सिखाया कि आप 1000 पेशेंट ठीक कर दो, मगर एक में कुछ हुआ, जैसे आपने ब्रेन डेवलपमेंट और ये सारी बात बहुत अच्छी तरह समझाई, कोई बख्शता नहीं है ना। और पेशेंट से ज्यादा पेशेंट के रिलेटिव्स गुस्से में होते हैं, जबकि बहुत बार हमारे आयुर्वेदिक चिकित्सक की गलती भी नहीं होती है ना। हमने एज पर एथिक्स ही काम किया होता है। तो भी आजकल का जो समय चल रहा है ना, तो उसमें मैंने देखा कि भाई बड़ा सावधानी से काम करने का समय है। और जैसे आपने बताया कि सेफली हम जहाँ पाथवे अपना कर सकते हैं, है ना, उसी के अनुसार करना चाहिए। ये बिल्कुल सही है। और मैं चाहूंगी कि हम सभी आयुर्वेदिक चिकित्सक इस विषय का ध्यान रखें। डॉक्टर उज्ज्वला, यू कैन आस्क योर क्वेश्चन।
जी मैम, नमस्ते मैम, बहुत ही अच्छा था सेशन। थैंक यू हेतल मैम। मैम, इंग्लिश और हिंदी?
English, ma'am, preferably. That's what I'm feeling.
Okay,
Many are in
okay, ma'am.
Hindi. That's the thing.
So, ma'am, I have seen two or three of my cases like PCOD with menorrhea since menarche, age of 23 to 28 years, like two females. So now after my treatment, they are getting regular periods, but
Yes.
their PCOD, like cyst size, not reduced, ma'am. Why?
And one thing can I tell you, like symptomatically you had succeeded, and even you do the follicular study. Though she is seeking for fertility, ma'am.
No, ma'am, no. Both were unmarried.
Unmarried, fine. See, madam, the polycystic appearance. You know, like already, I think you're basically in Prasuti person, ma'am.
No, ma'am, no.
Yeah, okay. See, polycystic ovarian disease, what exactly it is? Like poly, that is many cystic appearance. We know like primordial follicles will be there in the every cycles in each ovaries, 10 to 12 primordial follicles will be releasing, and 20 immature Graafian follicle, one will be dominating at the phase of follicular growth development from 5th to 12th day, and 12th to 14th day, plus or minus 2 days from 14th day, there will be ovulation. One dominant follicle should release. But what happens if that is not releasing? Immature graphene follicles remains like immature, and in the ovaries all immature graphene follicles settling, and it gives like a polycystic ovarian appearance. But what exactly happens is, because of that appearance, even though she improves symptomatically, and when you do her follicular scan, if ovum is releasing, you no need to worry, because the polycystic appearance, whatever the immature graphene follicle is settled down, it won't go immediately. It takes its own course. If she is getting her cycles regularly, and when you do the follicular study, ovulation is happening, you are succeeded with your treatment. It doesn't mean that whatever the immature graphene follicle settle down, that disappearance of that appearance of polycystic appearance takes over a period of 1 year or 2 years. It depends on the individualistic. So you don't need to worry much. If you get symptomatically, she improved well, she is getting her cycles regularly, and her follicular study shows ovulation is happening, you had achieved your target. You got my point, ma'am?
Yes, ma'am. Thank you so much. Because one of my patient, she was married and
Mhm.
she conceived. She was
Then you
suffering
got
with
your answer,
PCOS.
no? Because PCOD is anovulatory cycles. Without ovum, there won't be fertility. You had succeeded with the fertility. Ovulation had happened, and
Yes.
even though after fertility had happened, conceived, even the polycystic appearance will persist.
Yes,
Okay?
ma'am. That's
So
why
you
I
don't
was
need to worry on that.
confused. I was confused, so I asked this question. So we have to treat like a Lakshana only. If that is, if regular periods, we don't have to worry about that
Yeah,
cyst.
but think it in the line of Agni Dushti. That's what I want to say. Whatever the disease, don't leave the basic principles of Kaya Chikitsa. Even though I'm a Prasuti person, I should think and assess in the baseline of Kaya Chikitsa.
Yes, ma'am. We should. That is correct. And one more question I have, ma'am. Patient is not mine. The case has come in the group. Like the patient has a little prolapse of this uterus
Mhm.
and like dugdha like urine appearance, milky white,
Of
milky
urine, no?
white. Yeah, milky white, total
Okay.
white urine.
Hmm.
So that we were discussing the case. So mutra virajaniya kashaya was given, and I have suggested Chandraprabha because she has garbhashay shaithilya also, and this urine also like prameha we can consider as a kafaja prameha, and so that give Chandraprabha was given, but
Mm-mm.
still that urine color is not changed, ma'am. So
Go
what?
with urine culture and the urine routine, ma'am. Look into it, because see, underline, because I'm not sure what exactly
It
the
was
condition.
normal, ma'am. It was normal. That's
Mm.
why
Yeah.
that's why I asked this
Then
question.
go with the Ushirasava or any which support her, or even you can go with Uttarabasti plan, where you can go with a bladder wash like with Panchavalkala and other things. From the baseline, you can clear it off, if at all, or any other complaint she is having associated. Accordingly, you can plan it.
Okay, ma'am. Thank you. And ma'am, Matra Basti, if we have to give teenagers in dysmenorrhea, if
Mm-hmm.
Pittanubandha is there, Rakta Dushti is there. So you have told the Hanmantar Tela or
Mm-hmm.
Mahanarayana Tela. So how much quantity and how long we
Yeah,
have
so
to give?
normal like 60 that is first of all you are giving in a adolescent period 60 to 75 ml you can aram give, not an issue. And
Since
then
how long, ma'am?
depends on the sustainability of it. Look for 1 day. If she couldn't able to and immediately she's passing, there won't be an proper like nourishment like vata. This thing is not controlled. Start with 60 ml, and if she can sustain, give up to 70 ml. Not an issue.
Okay, ma'am. Thank you, ma'am.
जी बहुत बहुत धन्यवाद डॉक्टर साहब एक क्वेश्चन इसमें आया डॉक्टर आशा जयसिम्हा मैम 40 years patient amenorrhea all investigations are fine
Leave it like that. Leave it like that. Considered as maybe a early attainment of menopause. If she doesn't have any complaints and she don't want to seeking for fertility and everything is going good with her, let it be. Because all parameters and you evaluated, your side you are clear. Then why to? Because we know that the early see nowadays 6 and 7 years only the girl child is attaining puberty. And maybe early perimenopause and other thing we should wait and watch.
okay धन्यवाद डॉक्टर साहब डॉक्टर कविता सोहू मैम प्लीज से about the somrog treatment female patient having age 65 years suffering from Soma Roga since last 10 years.
What exactly the complaints, ma'am? Probably like continuous white discharge and other thing.
Dr.
Definitely we
Kavita, are you there? You can tell some more information regarding the patient. Hello, Dr. Kavita. Okay.
yes, whatever it is, ma'am, like Stambhaka line of treatment and Kavahara line of treatment is the need of the hour. And even the Kadali Kanda Rasayana is excellent there. And Mutra Sangrahaniya Dravyas, you can plan on accordingly. But preferably Kadali Kanda is having excellent, and then UTI related, you can plan a treatment. Like urinary system, how you treat it accordingly. And Stambhaka line of treatment, where Patrangasava, such thing, or Mushlika Diradi Kashaya, these all things, because Asti Pradara or like white discharge or something like that, where Asti Pradara, where we have Mushli Kadiradi Kashaya, you can use it there. And along with that, make a note, her nutritive value is good, especially the micronutrients. Okay, thiamine and other thing, those are all good, so that she'll be fine.
जी जी धन्यवाद डॉक्टर साहब. डॉक्टर मिनी राठी ने एक प्रश्न पहले पूछा हुआ था. विच ड्रग इज सेफ इन प्रेगनेंसी फॉर कॉन्स्टिपेशन?
Constipation, yes. Anulomana is not at all indicated, preferably in ahara dravyas. What exactly I do is try to inculcate the healthy food habits, especially with, I don't know what you say in your Hindi, that is ridge guard. Kannada I am getting, in Hindi I am not getting, and English also. That is hirekai we usually say, that is, and even lady's finger, those preparations she can use it in the food habits itself. Or ghee. Okay, ghee, if you can give it like not to the excess. Okay, because Sukumara, once again, Eranda is there, I can't give you to the extent in a early pregnancy, but still to the extent, if you want to go with it, where Dhanvantara Grutha you can prescribe. Okay, or Dadi Madi Grutha will look into it, because we will be carefully handling with the, especially with the pregnancy. And Anulomana as such, it is contraindicated, but even then you can go with Anulomana Churna, I am not telling, but still Haritaki Churna, one my sir used to give, Ashokan V sir, he is my teacher in my PG days, where he used to give in the judicial dosage of 1/4 of a teaspoon, depending on the patient requirement, that too with a chronic constipation, not in regular, that too with judicious monitoring. But I won't take a risk, frankly.
जी
Yes.
जी बहुत बहुत धन्यवाद डॉक्टर साहब. ट्रीटमेंट ऑफ द यूटेराइन सिनाइकी शमन शोधन बोथ.
Sinaki, it's an anatomical derangement, right? But based on the symptomatically, I can give a relaxation. But as a definitive treatment, it need to go with surgical management. Physiological and other condition, I can treat it. But an anatomical derangement, we can just symptomatically give a relief, but not the definitive.
जी डॉक्टर साहब बहुत बहुत धन्यवाद. डॉक्टर उज्ज्वला, आफ्टर विरेचन इन अत्यार्तव, ओके, अत्यार्तव पित्त प्रकृति पेशेंट, विच बस्ती वी कैन गिव?
In ma'am, repeat after Virechana, which basti we can give?
हाँ, आर्तव अति प्रवृत्ति, अति आर्तव.
Ma'am, Picha Basti will be the drug of means option. Otherwise, even you can plan with any like Mustadi Apana Bastis, where Brahmana Bastis or any Apana Bastis, you can plan it.
बेटा चैट बॉक्स में है, अगर आप क्वेश्चन है ना वहां से देख सकते.
1 second. If you try, no, nothing to worry. If uterine fibroid detected during pregnancy, as such, nothing to worry, because I have a case of 8 centimeter of fibroid uterus. She given birth to a twin pregnancy without having an R. Okay, but during pregnancy we won't operate fibroid because it's a high vascularity. You may end up with postpartum hemorrhage or an antepartum hemorrhage. Don't touch the fibroid during pregnancy.
वो शायद आपको एक ड्रग याद आ नहीं रही थी ना, डॉक्टर उज्ज्वला ने वो
Someone had kept, yeah.
है ना. हाँ जी.
Somaroga. had answered it. IVF procedure, why drug for hyperthyroidism is given during IVF procedure? See, it's all a planned pregnancy, right? During IVF procedure, why drug for hyperthyroidism is given? See, they will give as a prophylactic for everything. Even though they will go with low molecular this thing, ecosprin also they will give, and WHO recommends it. These are all like how we give a precautionary things. As a prevention is better than cure, they will be giving, because even though you give hypothyroidism or a subclinical management, it won't harm the mother, but it will be, if at all it gives a positive, it will be beneficial to baby. So, you know, to very planned pregnancy, some other required or a non-required things will also going to the mother. Okay. But as such, you don't need to worry much on it. Yes, because we are developing countries, out of 10, 7 to 8 members will be end up with hypothyroidism. It should not, because she's already on a hormonal balance only, IVF will be maintained. So they don't want to take a chance, even though they give one extra tablet of hypothyroidism, it won't damage the pregnancy outcome. So probably that is the thing. I think I said Inguvachashtaka. That's what Shatavari, Yashti, all are equal quantity. Usually what I practice.
Okay.
Sinaki. I think that much only. Right, ma'am?
Okay.
Yep.
We have completed all.
Yes. In this regard, yeah, once again, I should be grateful to my Dr. Gayatri Bhatt madam for giving me an opportunity, and my college, Jesus the Medical College, for giving me the opportunity, and above all, that Hetal Dava madam for giving me this platform to give my insight among yourself.
Dr. Ujjwala has raised hand again.
Yes,
गलती
please.
से हो गया डॉक्टर उज्ज्वला बताइए. हेलो.
हाँ मैम, नहीं वो इरेका ही था, वो जो रिच गॉड है ना, दैट इज इरेकाई मैम.
Hirekai.
Hirekai is
Hirekai
rich
usually
god.
we say in Kannada, because I am basically Kannada, right? That's the thing.
डॉक्टर गायत्री मैम अभी तो शायद नहीं दिख रहे हैं ना, अभी उन्होंने ज्वाइन किया था, है अभी डॉक्टर गायत्री मैम शायद नहीं है.
Yes, ma'am. I'll speak to her because I am pleased, because she is like my motherly touch. What I am today, it's all because of her guidance. So I am indebted and grateful to ma'am, and for you also for giving me an opportunity. Thank you, ma'am. Yes.
विश्व आयुर्वेद परिषद की ओर से तहे दिल से आपका बहुत बहुत हार्दिक धन्यवाद.
Thank you, ma'am.
आप जैसे स्पीकर के समर्पित भाव से फटाफट हमें आवश्यकता होती है तब खड़े हो जाते हैं और कोऑपरेशन हो जाता है. तो इसी के कारण ये 2015 से लगातार चल रही है, और
Yes.
मैं समझती हूँ कि आप जैसे लोग हमेशा मिलते रहेंगे, और ये हमेशा अनवरत चलती रहेगी, और
Thank
एक दिन आयुर्वेद भारत की राष्ट्रीय चिकित्सा पद्धति घोषित हो, और हमारे स्टूडेंट्स कहीं ना कहीं नॉट अ जॉब सीकर बट जॉब प्रोवाइडर. मैं अपने
Yes.
बहुत सारे स्टूडेंट्स को 20 साल से मैं टीचर हूँ तो कहती हूँ कि बेटा तुम्हारे कारण किसी कम से कम 3 लोगों का घर का चूल्हा जलना चाहिए, वो तुमसे इंक्रीमेंट मांगे कि बॉस इस बार ज्यादा इंक्रीमेंट चाहिए. पिछली बार दीपावली पे 5000 अलग था, इस बार 10 चाहिए. तो कितनी बड़ी बात है कि आपका हाथ हमेशा ऊपर की साइड रहेगा और आप बहुत सारे लोगों तक आयुर्वेद पहुंचा पाएंगे. बहुत सारे पार्टिसिपेंट्स ने इसमें सराहना की है लेक्चर की, उन सभी का मैं हार्दिक धन्यवाद करती हूँ. और मैडम का हमने काफ़ी समय ले लिया तो मैं सबके नाम नहीं ले रही हूँ. तो सभी पार्टिसिपेंट्स का इस व्याख्यान की सराहना करने के लिए भी हार्दिक धन्यवाद, और आपका भी डॉक्टर नंदा बहुत बहुत धन्यवाद.
Thank you so much, ma'am.
जी. सबसे लास्ट में मैं शांति मंत्र ले रही हूँ, आप सभी म्यूट रखकर ही दोहराएंगे. ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्. ओम शांति शांति. नमो नमः.
Thank you.
विश्व मंगल की कामना के साथ सभी का बहुत बहुत धन्यवाद. अपने अपने स्थान पर आयुर्वेद के प्रति अपना कर्तव्य निभाते रहेंगे. धन्यवाद.
Thank you all.